Hello, we'll be going over the CVA lecture notes, which can be found on Canvas, as well as information from your medical lecture notes. So the two types of CVAs, you have your ischemic stroke, which is their loss of blood supply due to some type of blockage, and also your hemorrhagic stroke, which is caused by rupturing of blood vessels in the brain. Under the ischemic stroke is thrombolytic, which is some kind of deposit is occluding the artery or blocking the blood flow. You also have your lacunar infarct. The lacunar infarct are small strokes deep inside of the brain. And the last one under ischemic strokes are your transient ischemic attack, most commonly referred to as TIA. A TIA can last about an hour, and it usually resolves completely within 24 hours. So the person will have full recovery. A lot of people say, oh, I never had a stroke, it was just a mini stroke or TIA, but a TIA is a CVA. And as I said before, the other type is a hemorrhagic stroke, and that's caused by the rupturing of vessels in the brain. This one can usually be more severe and cause more long-term effects because all that extra blood around the area is putting pressure on the brain. So people who have a hemorrhagic stroke can have a lot more damage because of the extra pressure and volume of blood pressing on such a large area. A treatment for this, or what medical management may end up doing, is a craniectomy, where they actually remove part of the skull to relieve the pressure. The next part I want to discuss is the anatomy. You have your cerebrum, which is made up of 4 lobes. As shown in the picture, you have the frontal lobe, parietal, occipital, and temporal. Another part of the brain is the cerebellum, and finally the brainstem. For the frontal lobe, it's responsible for the executive function, the person's personality, emotions, problem solving. So this type of person, if there's damage to the frontal lobe, a lot of times you'll see them being very impulsive, having very poor judgment. The patient may also have expressive aphasia. I attached a link below which shows an example of what expressive aphasia is. The person may have word-finding difficulties. The speech is usually very broken up. The parietal lobe deals with a person's sensation. They may have neglect on one side. We discussed in class that the most common side to have neglect on would be the left side. With both the frontal and parietal lobes, a person may have apraxia, which I'll discuss on the next slide. The occipital lobe, which you should all be familiar with, is dealing with a person's visual field and recognition. So if there's some type of damage to the occipital lobe, a person can have a blind spot or not be able to recognize things visually. The temporal lobe, which is on the side of the cerebellum, deals with the hearing, comprehension of language, memory. It's also the location of Wernicke's area. If there's damage to Wernicke's area, a person can present with receptive aphasia. And again, I attached a link of an example of this. With apraxia, this is common with either frontal or parietal lobe damage. You have motor apraxia, which is where a person knows how to perform a task, but they are unable to execute it. So they can verbalize how to do the task, but cannot perform it. For example, if you ask them to describe how to brush their teeth, they can discuss all the steps, but when they try to perform it, they're unable to do so. Another type of apraxia is ideational apraxia, where they cannot sequence a task. So if they're trying to put their shoes on and socks on, maybe they put their shoes on first and then their socks. With ideational apraxia, the patient can also confuse what an object is and what it's used for. So if they're trying to get ready in the morning and they see a brush and soap, they may try to take the soap and use it to brush their hair. Clinically, if you want to help the patient with this, maybe try to limit the choices. So if you want them to do one specific task, just give them one object to work with. With limb apraxia, it's a clumsiness of either the upper or lower extremity, and it's not accounted for by weakness. Another part of the brain would be the cerebellum. With the cerebellum, it's dealing with balance, equilibrium, coordinating muscle movement. If there's a CVA in this area or some type of problem or disorder, they could have ataxia, vertigo. We had gone over some key terms a couple weeks ago in class with the dysmetria, dysdiadokinesia, movement composition, and nystagmus. And the final part of the brain I'd like to talk about is just the pons and medulla, which are the two parts of the brainstem. This is the center for respiratory and cardiovascular system. It's controlling swallowing, coughing. It also has the nuclei of all the cranial nerves.